So we in Wake County, we have taken A2 side of the grant to really look at expanding our services in the community. So we do that through mini grants. We offer grants to community partners, faith-based organizations, nonprofit organizations to implement their services, grassroots, boots on the ground, meeting people where they are. Additionally, we have funded 8 community health workers that we have working with us who, again, are out in the community connecting our residents to essential resources that they need across the county and following up with them to make sure that they're actually getting the support and resources that they need. So Wake Wheels for Health is our mobile unit, our public health mobile unit. We take that out to health fairs, health events, and with that, we take any of the services that we offer in public health. It could be our HIV, STI prevention services, maternal and child health, giving away car seats, and instructing folks on how to use car seats. This past weekend, we went out and we had our Safe Routes to School went with us with the minibus, which is teaching kids on bike safety, helmet safety, injury prevention. With that, with Wake Wheels for Health, we go wherever we're asked to go. Wherever we're called, we get an invite. We take the minibus out, and it's accompanied also by our community health workers. So in addition to those educational services that we're providing, we also connect them with community health workers who connect those residents to needed resources and services. We're working on and just got approval, our CLIA certificate approval. We'll also be offering screenings with our Wake Wheels for Health. We go to where people are. It is mobilizing public health, taking public health to where our residents live in our county. So one of the things that we are doing right now is taking Wake Wheels for Health out to implement and carry out childhood vaccines. It's back to school time. Everybody is trying to get their children vaccinated before they go back to school. And typically in the past, they have to come in to us. They have to come in to the clinics. They have to go see their medical providers. But with Wake Wheels for Health, we can take it to where people are. So we can make sure that they are getting life-saving vaccines before they get to school. In addition to the childhood vaccines, we also have the ability with Wake Wheels for Health to do life-saving screenings. So we are out there doing blood pressure checks, diabetes screenings, and cholesterol screenings. And what this does is this gives our residents an opportunity to check their levels and potentially get into life-saving care before there are lifelong consequences. Our residents are so diverse and our county is large. We have got over 1 million people in our county with 12 municipalities, and everyone cannot get in to our building to receive services. Even though we have local regional centers that are local health and human services centers where folks can come and get services, again, we only have 5. And our county, again, as I said, it's 12 municipalities, over 1 million people. And we have access to transportation issues. We have access to housing issues in our county. We like to not make people work to get the services that they need. We come right to you. One of the things that I'm most proud of that we do with our PHIG grant is to get the funding out to our grassroots partners. Again, meeting folks where they are. We know they know their communities better than anybody else. And so those service providers and those grassroots organizations know where people are. They have the trust of their communities, and they're able to expand the work that we're able to do in public health. So some specific examples of some of the mini grants that we funded include Barber Shop Therapy. That is where our residents that are going to the barber shop, we train the barbers and the stylists to give basically mental health information and resources. When I go to my stylist, we engage in a deep conversation. What better place to get mental health resources to a place that you know you're going to go anyway, with somebody that you trust and somebody that you feel comfortable with. I'm really excited about that and how we're able to do that. And with that, we are also working internally inside our organization to reduce barriers for those small organizations to receive funds.